မင်္ဂလာပါရှင် Weekends with ဆွတာထွန်းအစီအစဉ်ကနေပြီးတော့ကြိုဆိုပါရစေကျွန်မဆွတာထွန်းဖြစ်ပါတယ်ဒီအပတ်ကျမတို့တွေ့ဆုံခန်းမှာမြန်မာနိုင်ငံအခြေစိုက်ကုလသမဂ္ဂရန်တရားရဲ့ညှိနှိုင်းရေးမှူးဖြစ်တဲ့ Mr. Ola M. Graham နောက်ပြီးတော့ကမ္ဘာကလေးများရန်ပုံငွေဖြစ်တဲ့ Unicef ရဲ့ဌာနေကိုယ်စားလှယ်ဖြစ်တဲ့ Miss June Kunugi ပြီးတော့ကုလသမဂ္ဂစီမံကိန်းဝန်ဆောင်မှုယုံ Unops ရဲ့ဌာနေကိုယ်စားလှယ်ဖြစ်တဲ့ Mr. Andrew Kirkwood တို့နဲ့တွေ့ဆုံဆွေးနွေးသားမှာဖြစ်ပါတယ်အကုန်လုံးသိပြီးတဲ့အတိုင်းမြန်မာနိုင်ငံဟာလွတ်လပ်ရေးရပြီးပြီးချင်း1948ခုမှာပဲဒီကမ္ဘာကုလသမဂ္ဂအဖွဲ့ကြီးကိုစတင်ဝင်ရောက်ခဲ့တာဖြစ်ပါတယ်။ကမ္ဘာနိုင်ငံများအားလုံးပါဝင်တဲ့ဒီကုလသမဂ္ဂရန်တရားမှာမြန်မာနိုင်ငံဟာအစကတည်းကနေတက်ကြွပါဝင်ခဲ့တဲ့နိုင်ငံတစ်နိုင်ငံလည်းဖြစ်ပါတယ်။ဒီအပတ်တွေ့ဆုံကမ်းမှာကုလသမဂ္ဂရန်တရားရဲ့ပုံမှန်အချိန်မှာလဲပတ်နေတဲ့အကြောင်းအရာများနောက်ပြီးတော့အခုလိုမျိုး COVID-19 ကိုတုံ့ပြန်နေတဲ့လုပ်ငန်းတွေကိုပါကျမတို့မေးမြန်းသွားမှာဖြစ်ပါတယ်ရှင် So first I'd like to welcome all of you to Weekends with Sisu. I'd like to welcome June, to Ola, as well as to Andrew. We are so looking forward to hearing from you what the UN does in terms of its normal programming in its service to the people of Myanmar, but in particular during these trying times when the world as well as the people in Myanmar is trying to respond to the onslaught and the challenges of the COVID-19. So, but before we go right into the discussion, if I may, ask you to take a few minutes for the benefit of the audience to introduce what the UN system as a system is doing and the respective agencies are doing, again, in partnership with and in service to the people of Myanmar. So if I may ask Mr. Ola M. Graham, who is the UN resident coordinator in Myanmar, to share with us what the UN system does in the country.
Thank you very much, Susu, for inviting us to your program. And thank you very much for the opportunity to talk to you and your audience about what the United Nations is doing in Myanmar. We very much appreciate that opportunity, not least now in times of COVID, but really any time. As you mentioned, Myanmar has been a member of the United Nations for a long time. And in the same way, the United Nations has been present in Myanmar for a long time. Today, there's 17 members of our UN family, such as you meet them here with Unicef and Unops, but 15 others that make up the UN country team in Myanmar. And it may be interesting to your audience to know that there's 2,400 people working for the United Nations in Myanmar. 2,100 of them are from Myanmar. So a very, very clear majority of my colleagues here in Myanmar who are from Myanmar, working with the United Nations for Myanmar. In very short, I can say that the United Nations is here as a partner in development. So we are here to assist the government, Myanmar as a whole, to advance on its development objectives. They are articulated in many ways, but perhaps a good place to find them is in the Myanmar Sustainable Development Plan that also links to a global development agenda that we call the 2030 Agenda and its Sustainable Development Goals. So our job here is to offer any assistance that we can within the means and the resources that we have at our disposal to assist Myanmar to achieve this development, its development aspirations, if you wish, and ultimately the prosperity for all in Myanmar that the country really has the promise for, and I think is able to achieve. So we're here as a development partner. We're also here as a humanitarian partner. So we assist Myanmar in humanitarian action, whether in response or in preparedness for and response to natural disasters, but also in situations where people suffer consequences of conflict that, as we know, is unfortunately present here in Myanmar. And perhaps as Well, let me say that in this work, we always make sure that in our programming, we bring in a rights perspective. So we look at human rights. We look at it from many different angles. One important angle for us is to make sure that in our assistance, we reach those who are the furthest behind first. And we also look at what we can do in our program and the assistance that we're offering to Myanmar to alleviate the effects of conflict and make sure that our program is assisting also in areas or in situations of conflict to find ways out of that conflict. There's many things that I can say about the work of the United Nations here in Myanmar, and June and Andrew can certainly add to that from their perspective. But perhaps if I pause here, and then we can talk a little bit about also what we do in response to COVID right now, since that's really at the top of the headlines these days.
Right. Thank you. Thank you for providing us with the overview of what the UN does as a system. If I can now go to June, you're the representative of Unicef here. So if you could share with us, Unicef has a huge program. So if you could share with us what Unicef does in general, in both, I guess, as Ola says, in both development and humanitarian context.
Mm-hmm. So thank you also, and Mingala Bashin to everyone. As Ola outlined, there is a long history of partnership with Myanmar, and UNICEF is actually marking 70 years of partnership. Last month actually was the 70th year anniversary. And we work, as Ola was saying, we work in development, humanitarian affairs, and also in human rights. And in our case for UNICEF, it's children and women's rights largely. And maybe just to elaborate a little bit further, we work at 3 different levels. We provide technical support and policy advice to the government to develop national policies and regulatory frameworks. And in this instance, for example, Myanmar adopted, after about 2 years of work, a landmark child rights law last year. And it really is comprehensive and reflects, the standards and principles of child rights that are universal. So again, it's a huge achievement. We also work in system strengthening, so definitely a lot of capacity building to support sustainability, so capacity building training of service providers in the different sectors, water, sanitation, health and nutrition, education, and so on. And then we also work with directly with communities and in our case, children themselves. So again, and particularly as was mentioned for humanitarian assistance, that's really where we get down to immediate relief in many cases, providing access to safe water, essential medicines and healthcare and protection services as well.
Thank you very much for that, June. If I may come to you, Andrew. The work of UNOPS is, I think it's since 1990s in Myanmar, somewhere from there. So if you could share with us what UNOPS does.
Thank you, Susu. I think all parts of the United Nations system have specialties. And UNOPS's specialty is a focus on the implementation and operations aspects of United Nations assistance. And we're seen often as the project management and infrastructure experts within the United Nations system. And that's particularly important in Myanmar because for decades, Myanmar didn't invest enough in infrastructure. And now it's trying to catch up, and it's trying to build thousands of new health centers, thousands of new schools, new roads, and new railways. And UNOPS is trying to help support those investments in a wise way. UNOPS is trying to ensure or help the government ensure that proper construction standards are met. UNOPS is trying to ensure that infrastructure investments are prioritized so that the limited amount of money that can be invested in infrastructure now has the biggest impact on Myanmar's development in the long term. We're also trying to help ensure that whatever construction is done now can withstand floods and cyclones, which we think are going to become more common with climate change. Yeah, and I think also, very importantly, we're trying to help create opportunities and incentives for the private sector to invest in infrastructure. I mean, Myanmar's infrastructure needs are so great that it's going to take very wise investment from the government, but also the private sector and international assistance if we are to achieve in Myanmar the sustainable development goals that Ola referred to. Unops, just briefly, is also an expert in public procurement, which is really important since a large part of government expenditure and taxpayers' money is spent through public procurement. And all over the world, and including in Myanmar, we are helping to ensure that public procurement is done more efficiently and more transparently. We're active in all 14 states and regions of the country, and I'm very proud to say that this is the largest Unops operation anywhere in the world.
Okay, with that, let me go to some of the general questions that I wanted to get your ideas on. I mean, we're talking about a situation, we just mentioned, Ola, about Myanmar Sustainable Development Plan. We talked about the Global Sustainable Development Goals, 2030 Agenda. But with this, challenges brought on by COVID-19, countries, governments, businesses, as well as organizations are having to reprioritize. And I'm sure that is no different to the United Nations agencies everywhere, not just in Myanmar. And yet the needs of countries like Myanmar, which has been a least developed country, the needs continue, while the need to address the onslaught of COVID-19 is there. So how do you balance the reprioritization? So if I may throw that question to the resident coordinator, Ola.
Can I first say something about what we are doing now in response to COVID? Because I think that partly responds to your question. So I mean, as we all know, COVID-19 is a public health emergency of global concern. It's a pandemic. Unfortunately, it has also reached Myanmar. Even though I think the efforts undertaken by the government to limit its spread have so far proven rather effective. So we hope that will last. But experience from other countries show that even with the very best of efforts, there's still a risk that there could be an exponential further spread of COVID. So we have to be extremely prudent, and we have to continue to work extremely hard to prevent its spread. So the United Nations globally is looking at this from in three dimensions, if you wish. One, which is what needs to be done to support the public health sector, to contain the spread, first of all, to treat those who fall ill, and then also to mitigate the economic impact, and not just the macro, the national economy, but also the social economic impact at the community level. So this is work that the United Nations is doing at the global level. It's also work that we are doing here in Myanmar. We've put a lot of work into the support that we can offer to the public health sector. And we are, of course, working very closely with the Ministry of Health and Sports. But since this is the effort that Myanmar has undertaken here is really a whole of nation, whole of society. Under the leadership of the State Council, we're working across government also. This has been expressed in a country preparedness and response plan. That we are rallying partners to Myanmar around in our offer of support to the national contingency plan. And what we've seen so far is really a strong support by Myanmar's partners, international partners, in support of national action. We're also looking at it from a humanitarian point of view. For those people who live, who are suffering, again, the humanitarian consequences, both of natural disaster, conflict, or otherwise, that they are truly reached in the measures that are now being undertaken and not forgotten. And we've been really pleased to see how government has also been working on that. We've been working closely with the Ministry of Social Welfare, Relief and Resettlement to ensure that also for those, for instance, who live in internal displacement camps now, measures to prevent and to treat COVID reach them. So that's the humanitarian dimension of this is important to us. And then perhaps a dimension that over time is going to be the biggest dimension, and right now very much an increasing concern, relates to what you said about the economic impact, the socio-economic impact, and how will that affect both the economy, the national economy, the social economy at the community level, and the aspirations that Myanmar has set for itself with regard to development, the Myanmar Sustainable Development Plan, the 2030 Agenda, the Sustainable Development Goals, etc. And here we're working now to look at both what we can do to assist in mitigating the socioeconomic impact, as well as, when the time comes, to recover from the socio-economic impact of COVID-19. I think an important dimension of this, where there may be, in fact, an opportunity of COVID is, as you said, now to go back to the drawing board and say, how do we adjust in order not to lose sight of our medium term, because it's now just 10 years until 2030, and when we hope to have achieved the objectives in the Myanmar Sustainable Development Plan as well as the 2030 Agenda. So what needs now to be done to adjust in relation to that? And is there something coming out of COVID-19 that can actually lead to reprioritization, perhaps, and acceleration towards these goals? That could be at least a thin silver lining to this very dark cloud that is hanging over us right now.
Thank you. Right. So it's always good to highlight, yes, during these dark times, that there's a silver lining to this. So thank you for that, Ola. I wanted to turn to you, June, if I may. I know that Unicef, does a lot of things in terms of WASH, health, child protection, social policy. So you've got a lot of things that you're doing. But for today's purpose, I wanted to bring our attention to the National Social Protection Strategic Plan, because that was the first. And I think it was launched in December 2014. And UNICEF was one of the co-chair in the technical working group. And so that National Social Protection Strategic Plan, one of the key objectives, if I understand correctly, was to build and to strengthen the resilience to cope with disasters and humanitarian emergencies. Now, as I was looking back and see, wow, we've got this plan that the country has actually, with support from our UN agencies and our international partners, have developed a plan to stand us in good stead as the country encounters this humanitarian emergency. So do you see elements where the existing structures and frameworks and policies allow us to deal with the unexpected onslaught like this?
No, absolutely, and you're absolutely right, because the country had the vision and the foresight to already start developing and investing in its own social protection sector plan, and already had a number of programs already developed, and it's one of the soundest investments one can make for a society, and definitely I think the ministry under the leadership of His Excellency the Minister of Social Welfare, Relief and Resettlement, committed to a universal approach, inclusive approach. And again, in a country like Myanmar, which is very large and very diverse, and there are many vulnerabilities for multiple reasons, particularly groups including children and women and those in conflict-affected areas, for example. But to have a social protection plan that is, but brings together also the different sectors, but provides social assistance, social protection to the most vulnerable is what exactly is needed. And as you said, it builds the resilience of a population against shocks and crises, just like this one. And so, for example, the flagship program of the social protection sector is a maternal and child cash transfer program, right? And already there had been pilots that had been implemented with Unops and donor support and NGOs. And then the government one was piloted and led in Chin State. And then it was rolled out in Rakhine. And also now in also Nagaland, Kayin Kaya. And now there's ongoing preparations for the rollout in Shan and Irrawaddy. It's already in process anyway. But just to say, you know, it's now because of COVID-19 also, you know, what's being prepared is also a top-up, so it's adding to that. So again, it's an investment in a social assistance program that reaches all pregnant women, also households with children under 2. So again, those, you know, we know that those are households that need additional support. So now in a time of crisis, they're going to get additional support. The program is also going to be expanded so as to reach more people in need. And again, and also because, and this is what was also visionary, was to link it with other sectors. And again, nutrition outcomes, to improve nutrition was a key objective of the social protection and maternal cash transfer program. So again, with COVID-19, we've seen that, you know, households are struggling to cope because many have seen income go down, many have lost jobs, there's been less trade. So again, the focus on also awareness raising, promoting good practices in nutrition for particularly babies, young children, is an investment in also protecting the future of the country by ensuring that children have good nutrition, households have support, and again, this is something that we can definitely build on. And I think COVID-19 it's a huge challenge. I mean, it's unprecedented in so many ways, globally, nationally, and locally. It's also, I think, we need to make it an opportunity to also look at where we were in terms of these programs that protect the most vulnerable and provide support to them, and see and make the case that there needs to be more investment and support. So again, we had a baseline where the whole Ministry of Social Welfare Relief and Resettlement was getting, I think it's only 0.4% of the national budget. So when you look at the types of social protection, social assistance programs, pension assistance, maternal child cash transfer, we would also make the case that there should be a universal national child allowance program. So again, I think we can make a case for more allocations from both the national budget but also for international assistance in these specific programs.
Thank you for that. I understand with the discussion we had with His Excellency the Minister a few days back that the budget for the ministry has been increased by 9-fold. So perhaps it's also part of the attempt to make sure that the most vulnerable are situations being addressed.
မြန်မာရေးရာကိစ္စတွေနဲ့ပတ်သက်ပြီးပြည်တွင်းပြည်ပကနိုင်ငံခေါင်းဆောင်တွေနိုင်ငံတကာတန်တမန်တွေပြည်တွင်းပြည်ပရပ်ဖက်အဖွဲ့အစည်းတွေကတာဝန်ရှိသူတွေနဲ့ထင်ရှားကြော်ကြားသူတွေကိုတွေ့ဆုံမေးမြန်းပြီးတော့အပတ်စဉ်တနင်္ဂနွေနေ့တိုင်းတင်ဆက်ပေးနေတယ် Weekends with Susu Tathong.
Andrew, if I may come to you, maybe it's also linked to what UNOPS is already doing. I know, as you just mentioned, that UNOPS is sort of help managing in line with international standards, many funds and many projects, such as a lot of infrastructure projects. But I understand you are managing what many people know as LIFT, the Livelihood, Food and Food Security Fund, as well as with regards to health. You're also managing the Access to Health Fund, and also in terms of what a lot of the needs in the country, in the peace process, the Joint Peace Fund. So, I mean, globally, we see that, yes, you know, so there's a tension that we need to make sure that we need to have lockdown, we need to have, you know, physical and social distancing, and yet those of us that can work from home is there, but there are many that are not able to do that. So how are you, in terms of managing these funds, how are you, again, similar to the question that I asked Ola, how are you managing putting a priority in terms of these big funds that you manage, or that's not something that you need to even consider because of the size of the funds? I don't know.
Thank you, Susu. I mean, we do manage all of those funds you mentioned. Thank you. We also manage the Global Fund for HIV, TB, and malaria. And all of those mechanisms have shifted to as much as possible to supporting the fight against COVID-19. It's the total amount of shifted is close to $50 million now. And it's roughly split 50-50 between focusing on the health aspects of the crisis and on the other hand, the economic aspects of the crisis. And balancing these is exactly what your question hints at. Getting the balance right between these two aspects of the response is exactly the key. And I think very clearly the government recognizes that. And in its new COVID-19 economic recovery plan, I think it encapsulates this need for balance in one sentence. And it says, the goal is to flatten the curve without flattening the economy. And I think that's such a great way of capturing needing to protect people from the really dangerous impact of this virus, but at the same time not doing that at the expense of creating too many other problems in the economy. From our side, the health funds, the Access to Health Fund and the Global Fund are spending a lot of resources to buy and import much needed equipment and supplies for the health response. We have already delivered 20,000 test kits to the National Health Laboratory. There's another 40,000 test kits on the way. We've procured and donated thousands of full PPE sets, and there are hundreds of thousands of more sets on the way. And we're also in the process of buying and importing quite sophisticated equipment for hospitals, including ventilators. And Myanmar simply just doesn't have enough capacity in its current system to deal with the possible health crisis that it will be created. At the same time, this isn't a health crisis only, and so the LIFT Fund, as you mentioned, is focused its efforts on, most of its efforts to date have been on, well, a large part of the effort has been on providing immediate cash assistance to the people who are most vulnerable to the economic impacts of the crisis, including old age pensioners, women with very young children, pregnant women, as Unicef mentioned, people who've lost their jobs through factory closures. We've also provided quite a lot of assistance now to migrants returning from overseas, from China and Thailand particularly, but also to the millions of migrants internally in Myanmar who have come to places like Klang Thaya for factory to support their families. We've also, I think, but probably most importantly, I think LIFT's assistance is really trying to do everything it can to get farmers the things they need to plant the monsoon crop. Fertilizer, seeds, plowing services. It really is important. I mean, Myanmar is still a very largely agricultural economy. Most people in the country are still employed in agriculture. It's really vital that we do everything we can now to enable farmers to plant a good monsoon crop. It will be good for the food security of those families, but it will be good for the food security of the country, and also minimize the overall economic impact of COVID.
Thank you. I actually have a follow-up question, but maybe I'll come back to that later if time permits. Thank you for that. If I may come back to Ola, you were mentioning about the work that UN does in terms of the peace support work that the UN does, and understanding that the internal conflict that the country has faced has been, as long as its independence. So, I mean, we saw in recent times the government outreach to the ethnic armed organizations, as well as the response that positive responses that we've seen in the papers. So can you share with us whether the UN is going to be working, supporting this process of assisting, working outside of the government administrative systems? So,
I mean, when in basically everything that we do, we do it at the request of the host country or the partners that we have at the national level. So here in Myanmar, I'd say that perhaps in the peace processes, we are a bit less directly involved here than we might be in other countries that live similar circumstances. But in the programming that we do, as I said earlier, I think we're still making contributions towards resolving conflict. One example is perhaps now that the national government has decided on its national strategy for the closure of IDP camps and the return and resettlement, which is extremely important because there's a conflict dynamic in that. So it's very, very important that that is done in the right way, not to sow the seeds of future conflict. And we've been working now with first of all, we think that the national strategy is a very good step forward. And we've been working with the Minister of Social Welfare, Relief and Resettlement again, on how we can shape our contribution to that process, which is really a process that is looking at today's situation, so the closure of the camps, what can be done, but more importantly, what needs to be done for those who live in these camps now to either return home or go to new areas of settlements that they would be going to voluntarily, with dignity, without stigma, and in a sustainable way that they can live there and they can work there. So that is, a contribution that we're hoping to see more of. Unfortunately, now with COVID-19, I think that has slowed down the initial intention by the government to move very quickly on this. It's a question of what comes first in the order of priority. But we're hoping to come back to that with more resources and more effort to see how we can support it. It's something that takes a long period of time. And it's something, again, for it to be successful, it needs to be very sensitive to the conflict dynamics that led to the displacement in the first place. So I think that is, could be a concrete example of what the United Nations is doing in support of the peace processes, even if perhaps we are not immediately involved in those processes ourselves. Another good example that I'm sure June can add to is the work that we are doing to protect children who are affected by armed conflict, and which is work that we're doing together with the government as well as the ethnic armed organizations.
Right.
I don't know, June, if you want to say a few words about that.
Like about working with children affected by armed conflict. I think the UN is working on that too.
Yes,
together.
There's a country task force on monitoring and reporting, but definitely in terms of looking at how children affected by armed conflict can be protected, and I think it is a pathway to peace because provisions for that were included in, for example, the NCA, and we also see in the child rights law. And there are very concrete things that can and need to be done, like to protect schools from being either hit or, barriers to education from being caused by conflict and so on. So yes, absolutely. And it's a fact that civilian casualties are increasing, including among children and women, and also many are being caused by landmines and explosive ordnance of war. And these are all things that need to be addressed so that Myanmar overall can have a much more peaceful, productive, and stable society. Yeah.
Thank you for that, because now we're sort of, in terms of our questioning, we've sort of looked at the conflict situations and the UN support to that. Maybe if I could come back to you a little bit later, June, on a different question, but maybe come to Andrew, because I understand with the UN OPS program that in the CERP that you just mentioned, the COVID-19 economic response strategy, there are quite a few areas that the UN is supporting, and also in light of the committee that was formed to engage with the ethnic armed organizations to respond to COVID-19. But also, in around 2017, there was a good example where, the ethnic health organizations and the Ministry of Health worked together with support from WHO to overcome, I think at the time, dysentery. Is there something being done, maybe with assistance of UNOPS?
Well, I'm glad you asked this question. It's such an important part of the COVID situation, is that the virus doesn't respect national borders. It doesn't respect demarcation lines between armed groups. The virus doesn't discriminate on the basis of ethnicity or politics. And I think, so it's very, very encouraging to see that groups recognize that in Myanmar. It's also very encouraging to see the formation of this group, with the committee to coordinate COVID-19 assistance with ethnic armed groups. And in that spirit, my colleagues in the Access to Health Fund and the Joint Peace Fund are busy now conducting a needs assessment in all of the areas of the country where ethnic armed groups are active. And based on the needs assessment and the requests that we will receive, we will provide assistance to the ethnic health organizations. I think the Access to Health Fund has made it clear that its support is for the country of Myanmar in this COVID crisis wherever it's needed. And I mean, in some ways, this, if I may, I was here 12 years ago during and after the Cyclone Nargis crisis, and there's some parallels for me. It feels like people all over the country and in different parts of society are coming together to face a common threat, and that's very encouraging.
Thank you. Yes, when we look at the impact of COVID-19, the health impact, some anecdotal stories as well as information that is gathered, children are able to respond to the medical side of the health challenge of the COVID-19. However, in terms of we're seeing that, but they are vulnerable in terms of their protection issues. There are so many street children that are out there that are not protected. And so many children, that due to the frustrations and the stresses in the families that are being exposed to child abuse and also child neglect. These are things, as Ola says, this is not something we're just doing at the national. This is impacting real people, individuals, and the most vulnerable. Can you tell us whether that's the right assumption that children, or what we're seeing, that the impact, the social and the protection impact on children are so much, and what is being done together with the government or together with civil society to look into that?
Yes, no, you very rightly raised this issue, and globally, and there's so much evidence that shows that, particularly as a result of things like the movement restrictions, the lockdown, the confinement, school being out, but also the shocks to the household, like increased poverty and lack of income, etc. So yes, in those cases, when there are pressures, when there are stresses, violence against children and women, unfortunately, increases. And so what has been done in Myanmar is that basically, the child protection system has been stepped up in terms of preparation for this. There's been additional support and training for caseworkers and case managers under the Department of Social Welfare of the Ministry of Social Welfare Relief and Resettlement. And there's also a counseling line now operated by Metanoia, so it's one of the partners we've been working with. And then also, again, there's a multi-sectoral referral mechanism. So if there are cases that come up either through the police system or through clinics, etc., there are case managers that will be assigned to this. there's also a lot of information that needs to be shared, and because I think parents are also, sometimes struggling to cope with how to manage, all the different household responsibilities and also having children at home. Also, we're working very closely with the Ministry of Education to try to have a back to school that will happen. And so right now, looking at areas where possibly there can be a return to school, but also looking at alternatives to classroom education, so distance learning, distance education, and basically equipping the ministry with resources and modules and training to reach potentially over 9 million children. And again, this potentially can be an opportunity to reach some of those areas which are the non-government controlled areas, so that, again, there can be more access to other options for education that don't necessarily mean that children have to be in a classroom. But definitely we know it's difficult for parents and communities, and so therefore we have been working closely with the government to try to find social protection and safety nets, also both economic measures that Andrew mentioned, but also monitoring and community alert systems to see are there cases that need to be attended to. And again, it's also something that COVID-19 it's something new, and we're all still learning about it. It may also be evolving. So while there doesn't seem to have been too many child cases, we hear, in some other countries we are seeing some new patterns perhaps. There is also a hotline that the Ministry of Health and Sports have set up also with our support. It's a very easy number to remember, 2019-2019, like COVID-19. So yeah, so people can call that number. It's operated 24 hours, 12 hours with actual 6 doctors and health experts, but also it can be a referral mechanism. So it has information about COVID-19, but also referrals to other services and support that may be needed.
Thank you, June. I think we're coming close to the end of this session. What a pity. We have so many more things to discuss. So if I could maybe just invite each of you to briefly, what message would you give to the audience? I know they're keen to learn, to hear from you. So perhaps brief message to the audience, if you will.
Well, I think to support Myanmar to realize its own objectives, whether they're related to development, whether they're related to humanitarian action, or related to, as we said, peace building and rights. We've been here for a long time, and we continue our work in support of these national objectives, as well as now when the country, in fact the world, experiences a public health crisis, to alleviate the effects of that crisis here in Myanmar.
Thank you, Ola. Can I pass it to Andrew?
Sure. I mean, the United Nations is usually quite good at learning from international practice and bringing it to countries like Myanmar. But when it comes to COVID-19, really there's very little global evidence about what works. But getting this balance between the health, I can't say it better than getting the balance right, flattening the curve without flattening the economy. No country in the world knows how to do this exactly, and we're here to try and help Myanmar figure out the best way forward on this.
Okay, thank you for that message. June, if I can pass it to take it forward.
No, and again, thank you for the opportunity. Just to reinforce those messages of partnership, we are here to work with you, for you, and in support of national efforts, and to work with communities, everyone affected. Just to say, it is also the 75th anniversary of the United Nations globally. And one of the key themes is that we need to listen to you, to the peoples of the United Nations, including Myanmar. So please let us know how we can better support you and work with you better in partnership to ensure that everyone's rights and needs are met. But really, I think the world will be learning a lot also from Myanmar. And again, some of the things we've mentioned, the social protection, the child rights. So again, we're all in this together, and together we'll address it.
Thank you so much, Ola, June, Andrew, for taking the time to come on Weekends with Sisu. I hope this is not the last and that we will have more opportunities to learn from you and learn from each other. Thank you.
Thank you, Susu.
Thank you. Thank you so much.